now. India on Friday reported a total of 7,584 new COVID cases in the last 24 hours. An upward trend in new COVID cases continued all across the country. The BA.4 and BA.5 Omicron subvariants are making their presence felt across various areas in the country, with the daily COVID tally now showing a rise across the nation. Maharashtra has recorded over 3,000 new COVID-19 cases. Nearly 2,000 are from Mumbai alone. Meanwhile, Delhi recorded 564 new COVID cases, the highest since May 15th. Experts said there is nothing major to worry about, though, at the moment, because hospitalizations are not increasing. However, a close watch needs to be maintained. Sujata Dwivedi is joining us live at this point from Mumbai. Sujata, how are the numbers for the last 24 hours looking like from Mumbai and Maharashtra? And with this increase in cases almost daily now, is Maharashtra government taking further measures, or are they saying there's nothing to worry about?
Yes. Good morning. So in the last 24 hours, we have seen that Maharashtra recorded a number of 3,000 cases, and in Mumbai itself it was 2,000. There was a death of one patient, and also 900 had recovered. So we see that the positivity rate and the recovery rate of the patients have been good throughout. However, Maharashtra government as of now is not that concerned about it, and as of now they think that it is not mandatory for the people to wear masks. However, the COVID task force, when we had a word with the officials, they have to say that it should be mandate, because in a city like Mumbai, where we see that there is crowd on a daily basis, it is important for people to have some sort of restriction so that they can make sure that they wear masks, maintain social distancing. Also, vaccination drives and vaccination camps have been organized so that people, they can take their booster doses and also the third dose of vaccination, so that the the cases can be combated. Also, in the city of Mumbai, places like Palghar and Thane, they have been recording a high number of cases, for which the people, they are trying to conduct surveys by going door to door at places as such, and try conducting tests. However, there were 15 to 20,000 cases, 15 to 20,000 tests that are being done on a daily basis, so that the asymptomatic patients who are infected with the COVID-19 virus, they can be logged in their home, and also so that the virus can be combated and the cases can be reduced.
Yes, and Sujata, of course, as far as the numbers go, is which are the hotspots in Maharashtra? Which are the regions which are contributing to the most number of cases, and have containment zones been drawn up? Is there a strategy to target the areas where cases are very high?
Yes. So the BMC here, they are trying their best to actually figure out all the hotspots, and also to actually put some sort of restrictions there. As I said before, Thane and Palghar here in Mumbai, they are currently the hotspots where the cases are rising, and there are a large number of cases that can be seen on a daily basis, for which the government there, they are trying to actually contact and test the relatives or the people in touch with the positive patients. So the people who were tested, so the people who are testing positive with COVID, their relatives and their family members are being tested in their area, and the government is also trying to set up vaccination camps, and also some sort of booster doses are being arranged for them in such areas. Also, the slums here in Mumbai, the COVID task force, they are trying their best to keep an eye on them, and also so that people, they are maintaining their social distancing. Large number of crowds don't gather. They are making sure of it, and the BMC, they are basically looking into it, and they're trying that people don't gather on such hotspots. And currently in Mumbai, we can see that Palghar and Thane are the areas where people are where the cases are rising.
Right. Stay with us, Sujata. In fact, we have Dr. Swati Maheshwari, senior physician, also joining us at this point on the broadcast. Dr. Swati Maheshwari, there's a rise in COVID cases being reported from across the country. What do you attribute this to?
Yeah, good morning. I think the way the movement has started, and people have started getting complacent in terms to COVID appropriate behavior, that is definitely leading to rise in cases. And that's what we have seen with the virus also, that as the more variants they start circulating, which are more contagious, which can transmit more, the chances of getting infected are higher. And therefore, as you see with the summer vacation coming up, and with also people resuming their work and their businesses and all and everything, and the travel going up considerably right now, I think that is what is leading to the surges. And again, if you look at it, the Omicron variant that is circulating right now, which is BA.2, 5 and 4, all these have enhanced capacity to attach to human cells. They are more contagious, they transmit more, so therefore the chances of people getting infected and these hotspots getting created is much higher, and that is what we are seeing. Again, the good part is, as my previous speaker was saying, that the rate of hospitalization has not gone up. Severe cases we are not seeing too much, which is again some breather that is there. But then yes, we need to be very careful, because we have the vulnerable population exposed as well, the children who have not got vaccinated yet, and also the elderly, who, even if they take the booster doses and the vaccine, still the immunity system is not very optimal. So there are chances of getting severe infection as well. So I think that is the section of population that we need to be careful with, and therefore helps in curbing the spread of the infection. That is very essential. So take on to the COVID appropriate behavior and regulate your travel, because if you're traveling to places which are already seeing the surge, or if you're traveling to functions and crowded places and all, then you really need to watch and take a conscious decision whether to go to that place or not.
All right, Dr. Swati Maheshwari, stay with us. In fact, we also have Dr. Ishwar Gilada, infectious disease specialist and health expert, also joining us at this point on the broadcast. Dr. Gilada, should we be concerned with this spike, with this increase in cases being reported from all across the country, but particularly Maharashtra and Kerala?
Uday, for a long time I have been saying that Omicron is a variant of support rather than variant of concern. We should not be concerned at all. If we are having unexpected rise, yes. But this is expected rise, and when any kind of infection reaching towards endemicity, we'll always see such kind of outburst. What we should see, as Swati has said also, that we should see the trajectory. Out of infected cases, how many require oxygen, how many require bed, how many require ICU, and how many are dying. Current case fatality rate is between 0.1 to 0.2%, which is equivalent to what we see in flu. So if we are not bothered about flu, why should we be bothered about COVID flu? And if you look at, compare India with the rest of the world, Germany, which is 6% of India's population, and reporting 10 times more cases weekly, and they are opening up from today. Everything is opened up. No masking required, no vaccination certificate required, nothing required. You look at America, India is way below in the rank in number of cases, number of per week cases, etc. So I think our knee-jerkism should stop. As soon as cases go up, we talk about masking, we talk about this. That's wrong. Secondly, our vaccination speed is very low. Currently, we are vaccinating around 15 lakh per day in the country, which is almost 5 to 6% capacity of the country's highest capacity, which was 2.5 crore a day. And in that, the below 18 population, very poor vaccination in Maharashtra. 26% got one dose, 12% got second dose. So I think we should push that vaccination. Thirdly, those which are not, those which are having a comorbidity below 60, you are asking them to pay for the third dose. That is wrong. When 20 crore vaccines are going to expire, including 2 to 3 crore in Maharashtra. So I think we should open both the channel, free channel and paid channel. Currently, free channel is completely closed for below 60 people. So I think we are doing something which is counterproductive, which we are exposing our vulnerable population like below 60 with comorbidity, below 18 population which are not vaccinated, below 12 vaccination is not yet started. And there are different agencies working on cross purposes. We have a CDSCO or DCGI, which gives a license to A or B company for our vaccine. But the Nitagi company, Nitagi organization, which is the National Task Force on Immunization, they're sitting on it for 3-4 months. They don't allow vaccination to be done. So when two different agencies of the same government working at cross purposes, I think we should disband all such agencies, make 1 or 2 agencies. They are cohesive with each other and they will work. Otherwise, what we are doing, just giving licenses to 10 different companies for vaccine, but only 2 or 3 are available because they are not even allowed to give vaccination. So I think we should look at that, and masking should be there in very much crowded places, inside the halls, cinema halls, etc. Otherwise, mandatory masking is not required, and we should wait and watch. Nothing is going to happen because death rate is very, very low.
Okay, is that something, Dr. Swati, you agree with, that there shouldn't be too much of a concern right now because hospitalization rates continue to be low and so are the death rates?
Definitely, we are not panicked about this rise in the cases right now. Especially if you look at the last 2 waves, the hospitalization rate did not go up. Neither did we see too many of severe cases, and which is again because of the circulating variant which is there, which is the Omicron variant, which we consider not to be too lethal. And even the mutations that are there make it more contagious. That is it. But it doesn't. There are no new signs, symptoms. There are no severe disease. So there's not much to be panicked about. But yes, our vaccination drive definitely, as Dr. Gilada said, needs more impetus right now. Especially, we need to include the children. We need to provide more vaccines, and especially, I think we need to cut down on the booster dose duration that is there as well. Because right now we are giving it at 9 months. We can bring it down to 6 months, as most of the other countries are doing. So that can be a conscious decision that can be taken by the government. And again, yes, continuously harping about the vaccination and the booster dose is very much required, because people have started getting this notion that if you have taken the 2 doses, then the booster dose is not required, or probably it's a mild disease and it will fade off in 3-4 days, so we don't require vaccination anymore. But they need to remember that COVID also leads to long COVID syndrome, which is not related to severity of the disease. So even if you had mild disease, you might have long COVID syndrome. So better is to stay away from the disease as much as you can, and especially prevent the people who are vulnerable at home. What would my take with me right now.
All right, Dr. Maheshwari, thank you for joining us with your perspective on that story. Let me quickly get in Dr. Gilada as well at this point. Dr. Gilada, as far as restrictions though go, what sort of restrictions should be brought in at this point, and what should be the advisory given to people on how to follow this COVID appropriate behavior?
Currently people have become smarter than the governments. As we say that we have to live with COVID, they know how to live with COVID. A lot of people getting symptoms, they are not even reporting anywhere. They're doing a self-testing, they're sitting at home at 2 to 3 days, and they go and mix up again. So what restrictions currently required are basically livelihood has to go on, socialization has to go on. We cannot restrict socialization for long. Education has to go on. We cannot have a knee-jerkism where 1 or 2 child comes positive and you close down the school. That should not happen. And you should make mask voluntary. Don't make it mandatory. Don't penalize people. Those people which would like to go in crowded places, yes, you can make them mandatory, like in Mumbai locals, Mumbai buses, in halls and cinema halls. And what we see that the best COVID appropriate behavior is in hospitals. Irrespective of COVID surge or no surge, you go to all hospitals, you see all this staff, they're all masked. And you see in restaurants, you see in hotels, you see where the 5-star, 3-star, 4-star. So I think these are the good models to be emulated by other people. That these are the organizations, nobody has told them, but they still maintain. So I think some such thing should be there, but voluntary, no penalization and no knee-jerkism.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.